Welcome to The Impact Equation, conversations with leaders shaping a brighter future, with me, Adam Pike.
And me, Rafi Adelstone. With our special guests, we unlock the secrets of those who dare to transform our world. We talk to architects of change, pioneers in their fields, working towards a brighter future for us all. In each episode, we dig into each element of the impact equation. Today's guest is Dr. Hugh Montgomery, Professor of Intensive Care Medicine at University College London, where he also directs the Centre for Human Health and Performance. Hugh is one of those amazing people who just can't sit still. Not only is he a world-renowned scientist, clinician and teacher, but he's an inventor, entrepreneur, non-exec, published author, highly trained skydiver, ultramarathon runner, mountaineer, world record holder for playing the piano underwater, and the focus for our conversation today, the leading campaigner on the health impacts of climate change.
Hugh still works caring for patients in an intensive care unit in North London. He's on the council of the UK Intensive Care Society, chaired the UK National Emergency COVID Critical Care Committee, and consulted on a novel vaccine development. In his research capacity, Hugh has published nearly 600 scientific papers, several in Nature. He discovered the first gene for human fitness and helped to define the factors on which survival is based in extreme environments. Hugh is a leading voice in understanding the health impacts of climate change. He co-chairs the 35-country 52 Institute International Lancet Countdown on climate change, which reports annually. He also founded the non-profit Real Zero to campaign for climate action in the health sector and beyond. Hugh was awarded an OBE for services to intensive care medicine and climate change. Hugh, a very warm welcome.
Thanks very much, Adam. Thanks for having me.
Always incredible variety of pursuits. We'd love to know, what's the golden thread that motivates you? Where's all this energy come from? What drives you?
Well, that's an interesting question. I suppose at the core, creativity, has always been the thing. I'm not good at most of what I do, but the thing that I do seem to be quite good at is reading the runes and seeing where the bang for bucks might be. So in science, like most people, I don't know the right answer, but when I do see the right answer, I'm pretty much always right. And I like the creative process in science. So I suppose that's number one. The number two, I suppose, is also just wanting to have real impact for real people, which probably is partly familial and cultural. My dad was raised in a very, very poor community in Northern Ireland and had a real ethic for working hard and self-sacrifice, which I'm not virtuous in that regard, but it does seem to be a driver to me that I feel guilty if I'm not doing things that might be a benefit to other people. So I suppose that's led me through clinical healthcare and research, those two threads of creativity and social service. And now is really why I'm focused fully on climate change, because it's the big threat to my survival, and I'm 62, and that of my remaining son, who's 19.
Often when we hear about climate, people tend to think it's something into the distance. But I'm interested that you talk about your lifetime, Hugh. Could you tell us more about the immediacy of the challenge?
Yes, we are under absolutely massive threat now because we've ignored warnings for 160 years, really, 165 years since John Tyndall described the greenhouse gas effect at the Royal Institution, which is where, of course, shortwave radiation gets through these gases, that's sunlight really, and longwave radiation, that's heat, gets trapped by them. And Tyndall warned us saying, look, we're burning coal now, we're adding carbon dioxide as a greenhouse gas, this could heat the planet. There are multiple warnings over the following centuries, or century and a bit. Henry Kissinger warned over 50 years ago, even Margaret Thatcher did politically. In 1988 Toronto conference, we warned that we were already seeing climate change impact. We had to cut emissions from 1988 by a fifth by the early 2000s, which we didn't. Every warning has become more strident. 2 years ago, the IPCC, the Intergovernmental Panel on Climate Change, that's 23,000 scientists, said that we needed to act immediately. There was no further time to delay. And I'm quoting directly, and if we fail to do that, we risk missing a brief and rapidly closing window to secure a livable future. We've now got self-perpetuating feeding frenzy of feedback networks that are driving up accelerated heating, which is why we've seen these lurches in ocean and sea temperatures and land surface temperatures in the last few years. The Arctic is now nearly 3.3 Celsius above pre-industrial levels. Europe is way above 2 now, and it's rapidly rising. And this will lead to, if we keep going, a mass extinction event on a Permian level. That'll be 96% of life on Earth gone. As the actuaries and insurers warned, it will lead to economic collapse. There will be no economy. 18% of the world's surface area currently occupied by humans is shortly going to be uninhabitable. And that, with sea level rise, will displace north of 3 billion people, potentially more. With no food supply, no economy, we know what that leads to, and that leads to wars. And even if you felt that those long tail events where one thing leads to another are unlikely, we know from a paper in Nature earlier this year, we're committed to the loss of 38 trillion a year from the world economy within 25 years. So this is catastrophic. And if we wish to survive, and we wish our children to survive, there is no time left for complacency. We can only throw ourselves at this, which is now what I'm doing.
And Hugh, as a doctor, you've seen the very best and the very worst of humanity at its most difficult stages. And so I'm interested in your perspective on, despite all of those challenges, which have been clear for us all to see, why we have not seen action in any meaningful and sustained way.
Yeah, it's a very good question. And there are many components to this. I think the first is there is a level of ignorance, because one thing you learn in dealing with the media, and I'm sure you've had to deal with it yourself, is that they tell you there's no such thing as news, there's only a story. So if climate change was covered earlier in the year, unless something else has happened, it's no longer a story, therefore it doesn't get communicated. Secondly, there's been mass disinformation, which we now know has been very heavily funded by bad actors in the space, specifically fossil fuel companies, who've, just as they did with tobacco, have spread disinformation and has had a very compliant press with whom they're in bed. So people don't hear the message at all. If they do hear it over the years, what they've heard is contrarian messaging saying that it isn't an issue, or there's nothing that they need to do. The next bit, I suppose, is there's a political lens that's applied to this, as well as a lack of intellectual capacity inside the body politic. So our own government at stages in the last few years refused to get briefed on climate change because their political lens said it didn't exist. This was some left-wing conspiracy. Therefore, they wouldn't even hear about it. The other problem is they lack the intellectual capacity and education. So we as doctors are very broadly educated in physics, chemistry, sociology, biology. And economics. We can put these things together. The last cabinets we've had in the British government, there isn't probably a single person with any of that sort of knowledge. So even if they would let someone through the door to brief them, they wouldn't have the intellectual capacity to understand it. The political lens also sits squarely in an economic narrative. So I was talking with economists last week. Would you believe the standard economic models describe an increase in GDP as temperatures go up? And that's because they can't factor in multiple collapses in economic systems, nor in food supply chains, for instance, or the damage from extreme weather, or mass migration, or war. And one of them was telling me at 5 Celsius, there would be the economy much bigger. And I said, well, I'm not sure how you can have an economy if humanity has disappeared and 96% of life on Earth's gone. So I think those all play into it. There is an issue now of penetration at all. Most people under the age of 30 get all their news from TikTok. They're not going to see these messages from anywhere else, nor do they anymore really weigh and interrogate information in the way that our generation potentially did. And then finally, people don't know what to do, or they feel they're locked in some evil tessellation of inaction. So a government will say, well, businesses won't like it if we try and tax them. The businesses say, well, the government won't legislate to give us an equal playing field, so we can't do anything, and the people won't buy our food. The people say, well, the politicians aren't making us do it, and the businesses won't, so we can't. And then globally, the government will say, well, if we move and the other governments won't, we can't do anything. A business will say, well, we can't change because an international competitor would take us. Mm-hmm. And you might say, well, there's no point in me doing it because someone in India or China won't. So people feel paralyzed and also feel ineffective in the small things they do. And one thing we've got to help people understand is that we are the only people who can change this. If we together, you, on this conversation and I make changes today, and we change 7 other people, well, let's suppose you do. And each of those 7 changes 7, a bit like the R number of COVID. By the time you get to 12th cycle of infection, as it were, 13 billion people have changed. That's nearly twice the number of people there are on the planet. So if we could just get everyone to start taking action, we can change this tomorrow, because the politicians will follow us and so will the businesses.
Let's make it really practical for people then, Hugh. So obviously the problem's so big, it's hard to comprehend. So if you could just bring us down to the real specifics on the health side, what are the expected health challenges that we're going to see in the next 10, 20, 30, 40 years? And then on the positive side, on the sort of solution side, what are the things that you're campaigning for through Real Zero you think people need to be actively pursuing right now they can do today?
Well, on the health impact side, I suppose what the Lancet Countdown has spent the last 6 years doing, and then the commissions before, was mapping all the changes in ozone, particulate pollution, heat stress, pollen allergenicity and burden, chemical pollution, algal growth, bacterial growth, changes in vector-borne diseases, etc., etc. And those are all real, and that we're seeing them more and more. Just as we're seeing the inability to work outside because it's too hot, and we're seeing the impacts on food growth and therefore stunting and starvation. But in all honesty, I think those are minor issues. The issue is going to be the social determinants of health. It's when you've got 4 billion people migrating with no economy and food, people will be nuking each other. And look at the social disruption you get with a few hundred refugees or a few thousand. What happens when you've got a few billion trying to move up as North Africa, southern Italy, France, Spain, Portugal are uninhabitable, and there's no food, no banking system? The thing that will kill you and me will be the economic collapse, the migration and the war. Those are the big ticket items. And when they happen, they'll happen very suddenly. The positive side then, well, it's hard to see a positive side other than the fact we just have to do the right thing and act as individuals. And that's a point, the first thing we should make clear. People in the Second War would volunteer as, 5'3" primary school teachers who spoke a bit of French, volunteer to be dropped into occupied France as SOE agents and a radio operator at a time when the average time to be captured, tortured, raped and killed was 11 days. But they still did it. And they didn't say, well, millions of people are fighting, what can I do? One person doesn't make any difference. They did the right thing. And the first bit we've got to do is say, we've all got to do the right thing now. There isn't time for us to have some sort of moral offset and say, well, I quite like my flight to wherever, or we've got to do the right thing. The things we can do, though, are oddly enough very simple and really rather boring. So the first thing is we need to remove the social license for financing further fossil fuel extraction. So the oil companies and the fossil fuel companies already own assets 3.5 times greater than will kill all of us. And they plan to extract all of them, and they're exploring for more. And your bank account almost certainly pays for that. Why would you pay for your own death? Why would you pay for the manufacture of the gun that's going to be used against you? It makes no sense. So move your money from a high street bank, because they all fund fossil fuels, and move it to one that doesn't. So Cooperative Bank, for instance, Nationwide Building Society, Online Monzo. Boring, simple. You go online, it takes half an hour. It moves all your direct debits for you. And if they make a mess of it, they give you compensation. So that's easy. Don't invest in fossil fuels. If you've got a pension fund or shares, get them out. As most, I sit on 7 charity boards, they've all divested from fossil fuels. So we can do those things too. Move your power supplier. So if you're not with Good Energy or Octopus, for instance, you move this evening. It takes 10 minutes. You don't really notice anything, just the bill changes. It shouldn't be any more expensive. And the electricity you're using then comes purely from renewable energy. So that's straightforward. Food is a quick win. It used to be very sort of flaky, didn't it? Everyone said, eating largely vegetable-based diets, it's for beardy, weirdy, tree-hugging, finger-knitty, musing-eating, sandal wearers. But 38% of greenhouse gas emissions come from the food supply chain. 22% of global heating comes from methane, a lot of that from belching cows. 73% of tropical and subtropical deforestation comes from trees and rainforests being chopped down to graze cattle or grow feed for them. Refrigeration for dairy products and meat is massively energy expensive. So actually moving to a diet that's largely plant-based and local and seasonal makes an enormous difference. I'm not saying you've got to be a vegan. Just cut right down on the amount of meat if you are going to have it. And if you are, have smaller portions and try to choose chicken or pork because those animals don't belch methane. And your life won't be any worse off. In fact, vegans have a 35% lower risk of ischemic heart disease, and just an increase in 200 grams a day of plant foods in your diet lowers your risk of cancer by 4%, and it lowers your risk of coronary disease and stroke by between 14 and 18%. So you'll live happier and longer and more cheaply by eating a different diet. Transport's important, so try not to fly. If you're going to fly, realize that you're putting usually tons of carbon dioxide into the atmosphere. And if you're going to try to be halving your greenhouse gas emissions within the next couple of years, which you need to, it's very, very hard to make that saving in any other way. So just weigh it up. If you really think you have to fly because you've got a sick relative somewhere, well, weigh up how you're going to reduce your emissions elsewhere, and don't offset because it doesn't work.
Hugh, I'm interested in the interplay between, on the one hand, your intensive care work sees outcomes very, very quickly, and your climate work has a longer term impact. I'm interested in the skills that you use in both. What are the similarities between skill set in achieving both positive outcomes on the health side and positive outcomes on the climate side? Are all those are actually they far more in sync with one another than perhaps we would perceive?
Well, it's a very good question. I can't claim to have had any impact on climate change. In my favour about that, I suppose, is that no one else has either. But I've tried lots of things that haven't worked. I think the similarity is because with intensive care, we're used to dealing with emergencies. And one of the things that makes me very cross is when people declare climate emergencies and then treat it like homeopathy. When I get called to the ED and someone's bleeding out from somewhere or is properly sick, I don't convene meetings to discuss it and weigh up whether they're bleeding out and then have an annual meeting to talk about it and then try to invent a new drug that might be applicable in 4 years' time, which for the analogy is like having the COP negotiations every year and thinking about carbon capture and storage. What I do is I stick a finger on the bleeding point. I shove a tourniquet on, I whack in a grey Venflon and get 6 units of O-neg up. We're used to doing what's required. And as you know in medicine, what dictates what we do is what is both necessary and sufficient. So we don't do things to patients that we shouldn't do that aren't helpful. But we do the things that would help them. We do them at the right scale. So we do what's necessary, but we also do it at a sufficient level. There's no point in giving someone half the dose of antibiotics they need because they'll still die of meningitis. So you give them the right dose. So I think that's what I would bring to this argument, is that there's woolly thinking around this. This is a genuine emergency that will kill us, and it's irrevocable. The planet will not recover in geological timescales, and it's going to happen in our lifetimes because it already is. So what we need to do now is apply the equivalents of the tourniquet, the Venflon, the 6 units of O-neg, and a quick trip to an operating theatre to climate. And that means, whilst, yes, we need carbon capture and storage, we may need geoengineering. But while we invent those, we've got to get on and cut the emissions. And we've got to do it using every tool, the everything, everywhere, all at once that we've got. And that's the way we would behave in a hospital, isn't it? You and I, with an emergency.
So tell us a bit about your work then with Lancet and with Real Zero. What are you trying to achieve through the countdown? What is it? How does it work? Where's it going? And then with Real Zero as well, what's the aim for the organisation?
Well, I can tell you where the Lancet Countdown was meant to be going. What we were trying to do was count down to 2030 on the Paris deal. So what we were trying to do was report the climate physics, how good or bad, which way is that going, emissions, climate finance and technology, what's being deployed, how quickly, with how much money, what is the progress and impacts of health impacts of climate change getting better, worse, and then the social and political sphere that might be feeding into all of those changes. It's not turned out that way because there's been absolutely no progress at all on Paris. We're clearly through 1.5 degrees already. If you thought it was safe, which we now, of course, know it really never was going to be safe, and it was never interestingly put forward as safe. It was always reported as 1.5 degrees, the level scientists say is safe. That's not true. It was chosen because the negotiators thought we might be able to reach it. And we can't now. We're through 1.5, I think, without doubt. There is no progress. Emissions are still going up. The positive feedback loops are now all kicking in. The diseases are getting worse. The desertification is worse. The extreme weather events are worse. Every single metric is worse. And of our key indicators, 11 of them broke records this year compared to last year. So what it was meant to do was to provide evidence of progress and encourage it. And all we've done really is document our own extinction in the process. Real Zero is my effort to try to do something that might have impact. So it's charity funded. We're a charity funded non-profit. And I'm trying to leverage the move of the money within the healthcare ecosystem, because whilst healthcare is only around 5% of greenhouse gas emissions overall, which is still substantial, but it's modest in other regards, we're nearly 11% of global domestic product. If you add in buildings and IT in the health system, it's a lot more. If you add in the penumbra of the companies making health tech and drugs, it's more again. If you add in domestic and consumer healthcare products, Durex, Dettol, toothpaste, soap, it's more again. We're a relatively constrained ecosystem, and we're also an ecosystem where we can't really ethically have collateral damage. I guess if you make guns or mines, if a few people die while making them, well, I guess people are going to die from the use. Healthcare isn't like that. And because we're relatively constrained and meant to be beneficent, I'm hoping there's the opportunity to move the entire health economy quickly into zero carbon. Because if that happens, it's a lot of money. That's going to be north of 10 trillion a year, and others will follow, and the pension hedge funds will move as well. And I'm doing it bottom up, so healthcare workers, bottom down and sideways, so rural colleges, representative organisations and bodies, but also companies. I'm trying to get everyone to work together to move the money.
And how? What's your approach? Like, what's the mechanism you're using to engage these people, these different parts of the system?
Everything, anything that we can think of. So messaging directly to healthcare workers, going to representative organisations to convince them to move. So a rural college to move its bank, its power supply, its food, its transport policy, its conferencing, but to message to all its members to get them to move and to make the changes as well.
And what's the sort of nature of the message?
Essentially what I've just described. So the immediacy is of crisis and the things everyone must and should do right now.
Right. Because a big part of the debate in climate is really this question about what will drive behaviour change. Is the challenging reality so scary that actually turns people off? How have you found that? I hear a lot of people talking about, for example, Hannah Ritchie's book, Not the End of the World, How We Can Be the First Generation to Build a Sustainable Planet, telling like a sort of positive story around the growth of renewables, that people seem to want to believe that we do have the opportunity to change things.
Well, I mean, I think I'd agree. We have an opportunity to change things, but we've got to do it. But what we've had is 25 years of this woolly-minded thinking where we say, oh, we can't tell people scary things because they run away. So you've got to tell them nice things. If you said to a poor person 20 years ago, hey, your life could be so much better if you were living a low-carbon lifestyle, they'll go, piss off, I haven't got any choice here, right? I've just got to get food on the table, and I don't have a choice in my life. If you went to someone who was richer, middle class or wealthier, they go, what, a better life than what? My private education for kids, my skiing holiday in the winter? I don't see what's better about this. So this, it could be nicer message, made no difference at all. And we as doctors are used to telling people the honest truth, but then connecting them to the answer. So sometimes, of course, you do have to say to people, I'm very sorry to tell you you're dying and there's nothing that we can do. But more often than not, we would say, you have a serious disease and you need to take immediate action on this. And if you work with us, we can give you the surgery, the chemotherapy, or the whatever else, and you're in with a chance. But we're used to those things. So my approach is tell people the truth. If you don't tell people the truth, they're not going to act. And if you do tell them it's all woolly and fluffy and someone else will fix it for them, that's the message they'll take away. So tell them it's an emergency, it will kill you and your kids, but here are the things you can and must do. That does seem to get traction. Certainly the soft, let's all be nice about it, climate change is an opportunity to do nice things and have a happier life, hasn't worked. And, that old Einstein quote, always doing what you've always done, you always get what you've always got,
I'm interested in, I guess, whether there are lessons to be learned beyond climate. I mean, a lot of what you've referenced could be generalized as doctors are able to give clear and candid feedback to the patients, but politicians really struggle to deliver hard messages.
Yes.
And interestingly, over COVID, we saw, Jonathan Van Tam and others standing on stage delivering the news every day with publicly available data every single afternoon. And that obviously has disappeared as COVID has become less of an issue. So if we could cast our mind to other policy areas, what do you think politicians can learn from the creeping disaster of the climate catastrophe and how it could apply to other areas of policy?
Yeah, it's a very good question. And I think being fair to politicians, which it's easy to have a go at them, isn't it? But being fair, whatever they do, it's easy to be pilloried. And there will always be some sector of the community that will be very vocal in opposition. And they find it hard to control the narrative of that news. I mean, as we saw this week, in my view, or last week, the government doing a very, very good thing about its legislation on toxic food being advertised for the watershed. But if one person comes out and says, they're saying porridge is now banned, that's not what it said. It said the high sugar, high salt, ultra processed version of porridge won't be allowed. But it's not the story that came out. So I think the message I would have to politicians is engage more directly with the organisations that are on your side. I think Labour made a massive mistake with the farmers because I think, on the inheritance of farms, that was a mistake. They perhaps could have engaged better. And the farmers could have sold them a story that would have worked for the government about the way to change agriculture. I think they can talk better to doctors, and we will help carry that message, as you say, we did during COVID, and took the heat for people. And I was one of those people, very happy to say, this is what must be done. And of course, you get torn to shreds in the press when I famously told people they had blood on their hands if they were spreading COVID. But better that we get the heat. And then government is to say, well, this group of senior independent experts is telling us the following, and therefore we are following that advice. So that's what I would be doing. I would be having much, much more direct conversations and saying, Hugh and any others, are you prepared to take the heat and go public on what you think should happen and support governments? And that's an apolitical statement. I would do that for any colour or political persuasion of government if they're doing the right thing by the people.
Go on then, Hugh. What are your top 3 messages for Wes?
Well, the first one, I think you get some of them. So the first thing is the health system will collapse if we continue running it as is, right? We've got more and more old people, more and more comorbidities, and the diseases we're seeing are non-communicable diseases. They relate to sedentary behaviours, crappy diets of ultra-processed food, polluted air, drugs and alcohol. And if you got rid of those things and a few other social determinants, you would shut my intensive care unit, right? Smaller unit, you'd shut 13 out of 15 beds. Every one of those beds is £3,000 per patient per day. You could float any IT on a stock market. We know 49% of cancers, we can see the direct link to the environmental cause. We know that 89% of cases of coronary vascular disease and stroke, we can see the environmental cause. So the first thing we need to do is be bold and brave and not be frightened by the Daily Mail of being accused of nanny state. Governments legislate against things that are harmful for the population. We don't accept child prostitution as being legal. We don't accept Class A drugs like cocaine as being legal because they're harmful to the health of the nation. And yet somehow we let companies that make ultra-processed foods, for instance, or the people who want to drive their 4x4s in major cities, we let them do that on freedom. We don't give the freedom for your wife not to get breast cancer because of the diet they have or the lack of exercise they take, or to be free of lung cancer, which 2 of my cousins died from, smoking-related lung cancer as non-smokers. That sort of freedom to be free of disease is denied. The companies that do this are not paying for the externalities. So I think we just have to say, we do legislate for this because we cannot, if you want an NHS free at the point of delivery, we must turn the tap off for the driver of disease coming in. The second message, you asked for three. Well, I can give you a second one. So firstly, turn the tap off. And people like me, I'll be the turkey voting for Christmas, right? Sack me and shut the ITU if it gets rid of the patients coming in. I'd much rather not have them there and that they remain healthy. The second bit, I suppose, is about the way we run the health service per se. So I don't know if either of you have been ill recently or have had a family member become ill. My sister sadly died 2 years ago of breast cancer. And my experience managing her and of other friends and family members is that the whole system's broken down. You go onto a ward, you don't know, you can't find which doctor's looking after them. They don't know the patient. There's someone covering someone else. There's endless handovers where things get dropped and lost. When a patient's expecting something to happen, it doesn't happen. They don't know who to phone. I think we should go back to the system we had when I was a junior, which was it was called the firm system. So you had a consultant who had a senior registrar and a registrar and a senior house officer and a house officer. And as a team, you looked after those patients. And the hours were long. We're looking at anywhere between 80 and 168-hour weeks. And I did do 3 months where I was on duty continuously, 24 hours a day, 7 days a week, with no days off or holiday. And it sounds brutal, but I loved it. We had continuity of care. Patients were able to say, oh, that's Adam, that's my doctor. He looks after me. They give you a box of Roses chocolates when they left, say, thank you so much for looking after mum. You got those rewards. You got the reward of seeing people through to health or of helping them have a dignified death on a ward. So we got those enormous rewards. And the juniors at the moment are working these shift patterns, which are just horrible. They don't get the personal reward from the patients or the family members of that feeling that they've done something good. They don't see the patient from beginning to end. So I think, having done the maths, and this might be unpopular with some, I would double the hours up to between 70 and 80 hours a week. You could put the pay up 3 to 4 fold by doing that. You could shorten the training because people were having full-time clinical time. I'd offload the admin to other people. That would save a huge amount of money. And it would massively improve healthcare by doing it, and it would improve the quality of life of the medical staff concerned. So I suppose I'm probably going to stop at 2, because that's what I would do.
Talking about intolerable conditions, I know you've done some incredible things in your life in terms of, sporting exploits. Can you give us a few of the highlights?
Oh, highlights of sporting exploits in the past. I suppose the most enjoyable parts, I suppose, are the pushing myself. So I guess I'm one of those people who the main pleasure I get from doing things is in the pain and the making myself go on. So I'm a really rubbish ultramarathon runner. I'm never going to win anything. And mostly I've aimed just to get round and finish, which of course a lot of the time people don't do. The bit I enjoy most is the having to make myself keep going to get to the end. And it's the same really on mountains. A lot of the pleasure in that is forcing yourself on when it's really hard and you're exhausted. And the pleasures that come with that, though, are partly some of the long distance runs are beautiful. And there's one I used to do called Trail Walker, which was 100 kilometers between Petersfield and Brighton. And it was always in June. And absolutely just beautiful. Running over the South Downs for a day was exquisite. The big mountains, when you're away from everyone else, that the sound of ice and snow under the crampons or the axe banging in, the beautiful views around you, the colour of the light at high altitude, the sky is nearly ink blue, black. The shadows are sharp. The snow is white. The rocks are black. The air is clean. The companionship of being with other people on long runs or on big hills. And I suppose that's the teamwork part of it too for climbing expeditions. But the same with diving expeditions. You were away with a job to do and a group of people with one goal in mind, all of the same mindset. And I suppose that's going back to how that relates to health. It's the same. In intensive care unit is a close-knit group of people, doctors, nurses, pharmacists, physios, dietitians, doctors, all with a single goal in mind, all with the same mindset. So I guess as I'm giving myself psychotherapy, talking to you now, I suppose that is the common thread, isn't it? It's the wanting to achieve something important with a group of people who want to achieve the same goal.
And talking about something important, is it true that you're still the world record holder for playing the piano underwater? Is that right?
That is true, yeah. And I doubt anyone will be stupid enough to try and beat it. Every now and again, I get an email or a phone call from someone saying, hello, we thought we might try and do this. And when you talk them through it, they go, yeah, right, we won't be doing that then. It's very hard to do. It's for lots of reasons. We had to have a synthesizer in the end built to actually work underwater. And Yamaha built that for us. I don't think anyone's going to build that sort of device. They're probably too frightened about everyone frying or getting electrocuted anyway. And yes, the whole logistics of it. And of course, it turns out...
We're winning past health and safety.
Yes, and it turns out not to be very safe, actually. So I suppose I could have worked that out from saturating yourself with nitrogen, but we were only sitting at the bottom of a swimming pool. But if you're there for 110 hours, that's a lot of nitrogen loading, and you will bend. And I'm quite certain that I did. I've got lots of holes in my bones from presumably partly from other dives, but also partly from that.
Or from ultramarathon running or climbing Everest. So I'm sorry we've come to the end, but I would love to hear a bit more about what's next for you, Hugh. So with Real Zero, with the Lancet Commission, with your crazy sporting adventures, what do you have coming up?
So health service, I'll keep working in that. I don't ever see myself hanging my boots up until when?
Until Wes kicks you out.
Yes. Real Zero will be the main focus now, but as I say, much as I love science and I'm quite good at it, there isn't any point in finding cures for things if there's no one alive to treat. So working on climate change, I think I'll die on the wire doing that. And in terms of other or next projects, I'm just into chapter 5 of the next novel. So I hope to deliver that next year, which is another thriller. So that's the focus outside work for now.
Fantastic. Hugh, it's been absolute pleasure talking to you, even though most of what you talked about is absolutely terrifying. So thanks for that. And for our listeners, I'm sure they'll also be equally terrified. But it's amazing to hear about your work and the focus you have and the change that you want to drive, both more broadly and in the health sector. And we're really grateful for the opportunity.
Well, thank you very much for having me. And your listeners who are, if they are feeling frightened, and they should, because this is frightening, remember there are things you can do. And if you do these simple things today, and you get the 7 loved ones and friends and family and people you work with to make those changes too, you can be the person that saves the world. And that is we're the only generation that could potentially save our own species. And it could start here today. This could be solved in a year just because of someone listening to this podcast. So thank you very much for the opportunity.
Thank you very much, Hugh.
Thanks, Adam.
So Adam, Dr. Hugh Montgomery, what do you take away from that conversation?
Well, I mean, a really, really special individual who's achieved and accomplished so much in his career. The piece that really struck me was this interplay between his work as an intensive care specialist, dealing with the patient right there in the moment with immediate outcome, versus his focus on climate, which again, often we perceive as a long-term pursuit, but the way in which he articulated it was as if the patient is in the emergency department right here, right now, and needs to be dealt with. And it was that intensity and that focus that he had that really sharpened my mind, because I think I can be guilty of thinking of climate as this thing that is amorphous, something that doesn't directly relate to me, something in my protected bubble, doesn't affect me day to day, but clearly it does in ways that I don't appreciate often enough. So again, I never really thought about that there was much less difference between his professional career in medicine to his kind of activist pursuit in climate. How about you, Rafi?
I think that's beautifully put. It's really, I think you've really drawn something out there, really special, real insight. For me, I think Hugh is such an inspiring guy. He's one of those people that just pursues whatever he thinks is important. He pursues it to the max, whether that's climbing Everest or playing piano underwater or doing genetic research, and now his big focus on climate. And for me, that's so inspiring in that he is taking his understanding, his interest, and his philosophy, and he's applying it in the world that he knows in a way that's really powerful. And with his campaigning group, Real Zero, he's looking to really change I think it's 5% of emissions come through health in sort of broader sense. and he wants to be a real driving force for that, and he thinks he can do it. That's really inspiring. And I think that's what we all need to do in the climate sustainability world, is really think about our own areas of influence and how we can maximize our positive impact in those areas. And he is really doing that in the fullest possible way. So I'm delighted that we had a chance to talk to him, even if, as I said at the end, it is intensely terrifying the way he articulates the human impact of climate change and how difficult the world is going to get for all of us and for our children. Like, we've got kids. He's got, what he said, one remaining kid. And the sort of the sense of panic that he feels, and he's some, scientist, and he deeply understands the specifics of the implication of global warming. The panic he feels is something that we all need to feel.
I don't know about you, Rafi, but I sort of sat there thinking like, oh God, I wish people like him were in power 20 years ago when we needed this sort of cross-party, cross-governmental effort.
I think the purpose of what we're trying to do with this podcast, and I think, what Hugh is trying, it really exemplifies, is it takes everybody, it takes all part of the system, and everyone just has to do what they can do in the space they operate in. And we can't really hope and, just wait for the politicians to do stuff. It has to be everybody.
Amazing. Well, I think that's a very good place for us to end it, Raf. Good to see and speak to you again.
Cheers, mate. Until next time on The Impact Equation.
Thanks, Rafi.